Thank you, Sakshi, for that very warm introduction. It's a pleasure to join you at the November conference. And my greetings to Joseph, Imani, thank you for that presentation, Warren, and of course, the rest of the audience. And of course, our back-end crew that have been very helpful this morning. So I'll be speaking on biobanking regulation and governance in Africa. I want to share a quote for us I found very interesting from Daniel Webster. So it's on government generally. And it says, good intentions will always be pleaded for any assumption of power. And so here we can substitute constitution for governance and regulation. We can say the governance and regulation was made to guard people against the dangers of good intentions. There are men and women in all ages who mean to govern well, but the truth is they mean to govern. They promise to be good master, but they mean to master. And I'm sharing this quote just to highlight the importance of having robust regulatory and governance frameworks in any endeavor. So back to biobanking. We all know it's the practice of collecting, curating, and archiving biospecimens for research and for development, for technology. And in our settings, it's been a very key tool towards the acceleration of genomics research. In biobanks, large numbers of samples and associated data are stored so that these can be made available for further research, for technological development. And of course, in the context of COVID-19, we see how important that has been even in the development of vaccines. To serve its purpose as a research resource, biobanks should have defined mechanisms for accessing those specimens. They have to ensure that the biospecimens are used in accordance with the informed consent of the participants who have donated their samples. There should be policies for the disposal of those biospecimens. And for both parties, both the biobanks, the participants, the countries, and the collaborative researchers, there has to be a clear benefit sharing plan. So, of course, in the African environment, there are numerous challenges. And of course, we all know about the ethical challenges. But beyond this, there's limited resources that are available for the research. We know about the low levels of capable, skilled human resource for health and research, informed consent issues, the regulations of biobanking, and then limitations in country regulations regarding export of samples, benefit sharing, and even genetic discrimination. And of course, on the continent, the biobanking companies that are in operations here experience poor and low levels of visibility. So this challenges their opportunities for collaboration with partners across the world. The journey to biobanking in Africa. For decades, samples have been retrieved from Africans for research and development that has occurred outside the continent. And the motivation behind establishment of biobanks on the continent was the prospect of empowering African countries and their people whose samples have been collected by giving more control over the use of those biospecimens. But unfortunately, the regulatory frameworks for biobanking on the continent is limited, making oversight of biobanks challenging and encouraging unethical practices. During the West Africa Ebola virus epidemic, there's reports of specimens being transferred outside the country without recourse to local governing authorities. Biospecimens from Ebola virus disease patients were shipped out of Liberia, Sierra Leone, and stored in biobanks in other countries. Now, the people who these samples were collected from, in many cases, were not informed about where the samples were being taken or even the purpose for which the samples were taken. So this, you understand, was an environment of uncertainty. There was a huge pandemic. A lot of knowledge was not present on the virus, and there was an atmosphere of fear. So this was ripe for taking advantage, more or less, of specimens that were collected within that context. And so this also brings me to parachute research, where scientists from higher income countries can come to low income country settings, collect specimens, use for research, and publish in prestigious journals without proper credit to collaborators in the lower and middle income countries. And of course, because there's that lack of robust oversight or regulation in the African countries, there's a limit to how much this could have been curtailed. There's several biobanking groups, consortia within the continent, and I'm just highlighting a few. One of the earliest MRC in Gambia that started collecting samples as early as the 1970s. H3 Africa, that's born from a collaboration between the Wellcome Trust and US National Institute of Health. B3 Africa, GET Pathogens Treatment Consortium that was born out of the Ebola virus pandemic, Lassa fever, meningitis, and yellow fever across the sub-region. 54 Gene, their presence was strengthened by the COVID-19 pandemic, where they gained prominence. Now for the challenges, the lack of technical and ethical standards is one major challenge. The inadequacy of infrastructure for up-to-date processing and storage, and of course, irregular power supply within the continent, shortage of trained pathologists has proven to be a major hindrance to collection of high-quality samples. And I think that was even mentioned in the last poll about the importance of high-quality samples. Sustainability issues and difficulty in harmonizing the ethical, legal, and social issues regarding biobanking. Another quote from Daniel Webster: "The proper function of a government is to make it easy for people to do good and difficult for them to do evil." And I think this is one of the requirements of a robust regulatory or governance framework, to make it difficult for exploitation and easy for people to conduct quality research with the participants being protected. So there are three themes under which regulation on the continent crosses. And the first is there are countries where there are no regulations at all. There are those that have regulations, but these are so specific and narrow that they can quickly become outdated in a fast-changing technological environment such as biobanking and genomics. There are some countries that do have certain regulations, but they lack some key components. In up to 30 African countries, there are no official national or local ethical guidance for health research in general, more so in genomics. A national governance system should provide certainty and clear lines of accountability with regards to the legal and ethical conduct of any research. And so where there's a lack of national guidelines or regulation, it means that for those who are playing in the sector or seek to play in the sector, there's no clarity on what rules or procedures would govern their research. And so where there's a need to seek ethical approval, the local research ethics committee would have to make arbitrary decisions. And this then leads to inconsistency. And so when these procedures are unclear, there's no way to guard against the exploitation of research and the participants. There are a few countries, including mine, that have some regulatory provisions on genomics and biobanking research. So Nigeria, Malawi, Zambia, Ethiopia, South Africa. And what's important here is that while regulating the research is important, the regulations could be unsatisfactory because the precepts on which they were set are quite fixed and narrow. And so the research is often restrictive. And so where there's need for some flexibility, that can't happen because the guidelines that were provided for the ethical approval were quite narrow and restrictive. And then there are countries with regulations which lack certain key components. And the majority of African countries that do have some level of regulation fall into this category. So you'll see where there are gaps in the provisions for consent. There's lack of clarity on the ownership of the biospecimens, on data sharing, on even exportation and importation and transport of samples. And so these regulations also fail to sufficiently prevent exploitative research. And it can hinder the capacity building of scientists on the continent. So for optimal governance and regulation for biobanking, there needs to be an emphasis on not being overly restrictive, because this means that you would prevent robust and outwards facing collaborations that could strengthen the biobanking ecosystem within the continent and build vital capacity. The focus should be on guarding against exploitative research and exploitative collaborations. There's a disparity in capacity and governance between low and middle income countries and higher income countries, which can be addressed by looking at how participants and donors are respected, the upholding of privacy and confidentiality, how participants are informed about the potential risks through several initial consultations in a way that is clear and understood, because most times the participants and the donors, there's an information asymmetry. And so when they are communicated and consulted in a way that they understand, then that way they know the purpose of the research in a way that is digestible to them. Sharing of samples, data and benefits in a fair and transparent way. Ensuring quality and interoperability of the samples and associated data, of course, between institutions. Improving public awareness, trust, and participation in biobanks. And I'll be speaking more on this issue of trust, and defining the role that the private sector can play in the use of the knowledge that is derived from the operations of biobanks. So the areas that require a clearer and more flexible regulation are the consent for genomics research, how the samples are stored, how they're reused, export of samples and international collaboration, data and sample sharing, who owns the samples, so the ownership of the samples, and the return of genetic results, and of course, dissemination of results. Now, there's a very important trust issue here in the governance of biobanking, and I think it cuts across research in general today. It's that participants have to trust both the biobank and the researchers and the work that is being conducted in such a way that their participation is something that they see as a trustworthy activity. And in many low and middle income countries, participant trust in research has been eroded. And by implication, the trust in the researchers has also been eroded. But there has also been a loss of trust between researchers who are based in low and middle income countries compared to researchers in the higher income countries. And so because trust is important across different levels, it has to be addressed from the perspective of the participant and the researcher, the participant and the institution where the materials, the biospecimens will be stored, the participant trusts in the governance framework that is protective, and will protect them from exploitation. And trust between the regulators and the implementers. So the implementers should trust the regulators, and the regulators should trust that with a clear framework in place, the implementers know what to do and are doing exactly that. And of course, trust between researchers in Africa and their international collaborators. So a governance system that is built upon regulations that are legitimate, reflective of local values, and ensure accountability supports the development of trustworthy relationships. And trust reinforces accountability, and for us to build this trust across the multiple levels that I shared, there's a need for stakeholder engagement. And so key principles for good governance will include legislative frameworks, stakeholder engagement, institutional accountability, and community engagement. The Africa CDC has embarked on a project to establish a biobanking network as a means towards building a sustainable mechanism to accelerate development and evaluation of diagnostic testing in Africa. And I believe this was born out of the challenges that were suffered on the continent with getting access to vaccines. And so it highlighted the need for more continent ownership of the biobanking space and operations within the continent. And so I'll be saying here to highlight that African researchers do need to lead in the conceptualization, planning, and implementation of research using stored biospecimens. There's a need for robust governance mechanisms that are explicit in the promotion of research and limitation of exploitation. A key to good governance is a clear feedback mechanism to the institutions that are regulating the biospecimens that are collected from African people and stored in African biobanks and even outside of the country, outside of the continent. But the decisions about access to biobank resources should be made by representatives from African institutions. And African researchers should have preferential access to biobank resources. Another key thing is that the reuse of specimens should be prioritized for research about conditions that are vital to African communities by African researchers and then their collaborators. And to conclude, I'll say that the advanced development of biobanking in Africa will remain stunted unless there are mechanisms that strengthen how biobanking and genomics research are governed, and the regulatory frameworks are established that protect the continent from exploitation while enabling a sustainable ecosystem that builds local research capacity. Only then can we say that the journey to ensuring African leadership in biobanking research programs on the continent has begun and is underway. These are my references, and I thank you for your attention, and I'll share this last parting quote: "The people sleep peaceably in their beds at night only because rough men stand at the ready to do violence on their behalf." And so I'm making this call for robust regulation and governance frameworks that will do the violent work of protecting African biobanking and genomics research from exploitation. Thank you.
Thank you so much, Dr. Adaeze. I think we can all agree that it was such a powerful presentation, and the topics that you touched on, again, would make a great impact, I think. And I think you touched on various different important topics in terms of regulation and governance in Africa, and the gaps in research, and how participants are not informed, and sharing examples from Ebola pandemic and how the samples were shipped from there, and with no credit being given. And I think you also touched upon the issue of trust again, which is so important, and why why there are trust issues within the government sector, and also in biobanking activities. And again, the issue of exploitative research, and I really like the quotes that you used in between as well.